specifically about decision support systems in healthcare. More specifically, decision support systems are not just limited to businesses, but we use them in healthcare as well. So today, to join me, I have Umar. My name is Faraz Syed, and today we'll be talking more about decision support systems. So normally, when we think about decision support systems, we think that normally it's a software tool that we use to collect data, perform our analysis, do our visualizations, and then make our decisions. But that's not always the case when it comes to healthcare. There's much more to it, which we will talk about it. Sure. So when it comes to Philips Professional Healthcare Overview, the mission is to improve health and well-being through meaningful innovation in healthcare technology. Basically, when we think about the tagline of Philips, it's basically innovation in you. So it's more about that. And the global presence is primarily based in the United States with operations across North America and global reach. We'll talk about that as well when it comes to the region discussion. When it comes to recognition, they are the #1 in healthcare equipment services on the Forbes list. So more specifically now, let's get started about the topic of DSS in medical service. I'll go slow. All right. So normally I think whenever you go to a doctor, you have electrocardiograms, ECGs, and machines such as CT scans and also 2D echos and everything else. So those machines a lot of times give you a report of how your vitals are doing and everything else. But just imagine those reports don't give you adequate information, or those machines are not working properly at times. So that's what's happened. That's what's been happening with a lot of hospitals lately. So basically, those machines are used by a doctor to be able to make decisions about your health and which vital is not working and what do you have to do and everything else to perform trend analysis as well based on your health situations and everything else. And also a lot of times this information has to be synced with the CRM systems as well, so that the diagnostic reports are not just available to the doctor and the hospital, but also can be shared with you or your insurance provider at times. So a lot of times this is something that is very important when it comes to DSS in medical devices. So when it comes to Philips operations and customer base, the primary business of Philips is based in Andover, Massachusetts, but they have manufacturing plants like New York and Pennsylvania. So basically, Philips works with government agencies, and they work with academic institutions and the private sector at times, because a lot of times the government institutions, nonprofits, and also academic institutions like medical schools, as well as the private sectors like hospitals, need their equipment so that we can train doctors of tomorrow, as well as we are able to make the right decisions about people's health and give them the clarity that they need about their health. Now, I've been someone who has been a victim of that, because for 2 years I thought I was dying at some point, and that for 2 straight years I thought I had a problem with my heart, and even the doctor said that everything's fine, but they're not able to tell me where the pain was coming from. So for 2 years I thought I was dying, but by the end of the second year I realized that it was a problem with my pectoral muscle after going to a physiotherapist. So that's something that we have to address after a while. So the next thing you're going to talk about would be about, mine's connected, right? So the next thing we'll be talking about is the business strategy of Philips. So Philips Professional Healthcare's business strategy is hierarchical in a way, because that flows from the corporate level to the enterprise level. Whatever decisions they make at the corporate level, that lays the foundation to what flows down to the enterprise level. So basically, that's how we can define their business strategy. So first, we're going to talk about the corporate level strategy. When it comes to the corporate level strategy, when it comes to decision support systems, So when it comes to the corporate level strategy, we'll be talking more about they have executives such as their CEO and also their people's manager like Steve C. DeBaca, who actually is helping them with their expertise, and they have 30 years of expertise in the healthcare industry, and they're utilizing that experience to drive sustainable value. At the same time, they're hiring the best so that we can deliver the best to our customers, because patient safety and quality is the utmost priority of Philips. So whatever they decide based on this, whatever their prime focus is, they flow it down to on the enterprise level. It flows down to the enterprise level. So when it comes to enterprise level strategies, we have organic growth, people-centric innovation, operational efficiency, sustainability and global expansion, end-to-end supply chain reliability and agility, and patient safety and quality. When we talk about organic growth, Philips want to grow ethically. They want to focus more on their research and development and improving their resources in business from 90% to 70% in 2022. They are people-centric, just like I talked about, and like they want to reduce, redundant processes by 2025 by cutting down on jobs as well. When it comes to operational efficiency by 2025 by reducing redundant roles so that we can serve our patients better at hospitals. So when it comes to end-to-end supply chain reliability, we are ensuring that the products, Philips ensures that the products, the products that they make and the things that are being used, the components that are being used in those products can be easily sourced and can be easily replaced and managed at times. And when it comes to patient safety and quality, just like I mentioned, they ensure that they're complying with the local laws and regulations and everything else so that it helps in the betterment of those technological equipment used in hospitals. So when it comes to the region discussion in North America, just like I was talking about earlier, in North America what happens is that we have a shortage of healthcare workers in a lot of hospitals and clinics. We have like 80% of healthcare leaders agree about that one. And like we have to address that shortages when it comes to doctors and nurses and everything else, and like a lot of times when it comes to healthcare and health school workers as well. So the thing is, like, we have a lot of people who are involved in redundant processes. So that has to be addressed. And that's something that Philips is looking forward to address through AI and automation, and at the same time through the devices that they are using when it comes to all of this. And patient-centered care, I talked about it. Like basically. More healthcare leaders are coming forward in order to ensure that the products that they make can be utilized to provide better care to their patients. So when it comes to the collaboration in healthcare, yes, so building more on that one. So a lot of healthcare providers, technology innovators, policymakers are involved when it comes to building up policies or like building up like how specific equipment should be made or like should be structured in order to make better decisions. And a lot of times they're also partnering up with Phoenix Children's Hospital, Miami Cardiac and Vascular Institute to address address various cardiac issues and various health issues and cares that can be addressed and can be cured. So we are trying to ensure that we reduce the amount of people who are sick these days. And when it comes to healthcare leader engagement, they are more involved with healthcare leaders like managing doctors at different hospitals, nonprofits, etc., in order to be able to improve their product line. So when it comes to information systems in Philips Healthcare, I would like my friend Umar to take over and explain more about that in detail.
Oh, so this was a lot of details, right?
Yeah.
See, and I don't know, I'm doing. The whole thing Philips developed was surrounded and based around information systems. Decision support system typically is also an information systems, but to develop a decision support system which is so huge that it will coordinate all the data of every patient and every type of data, just like Faraz said, ECG, all the scans and patient histories, everything to analyze that data, to store that data, you need robust infrastructure. Therefore, Philips collaborated and coordinated with Amazon to get cloud, which is storage as a service from Amazon, AWS. Yeah. Philips is also integrating artificial intelligence in the decision support system so that it helps doctors get information analyzed in such a way that will help in making decisions for patient and improve the healthcare. Coming to the value proposition and sustainability, any and every system that we develop.
Go ahead. Don't cut.
Go in front.
Sure.
Yeah. This is reverse technology. Yeah, you're going back.
Yeah.
Value propositions. Why are we discussing Philips? Because we thought healthcare is very important. Apart from every other industry, healthcare industry is something that we think has to be developed constantly, because at the end of the day, it all boils down to the human health. So Philips is trying to develop a decision support system that will revolutionize the healthcare system. It will revolutionize in a way that the modern healthcare system down the line in future they will forget how people used to operate without such systems. It will be such revolutionary because integration of AI in decision support system with all the machinery will give us an edge towards improvement of customer health. Philips is also developing technologies in a way that will reduce carbon footprint, which helps in improving the environment, as everyone right now and these days is environment centric. With this, I think I will conclude the presentation. Yeah, we have to talk about the future.
So this is the last slide.
This is the last slide. Future of Philips healthcare technology. Every company does look into future, and Philips with this healthcare technology is looking forward in future with these 4 points: sustainable healthcare, integration of AI, continuous innovation, and collaboration, as he already explained, with other industries. Thank you so much. With this, I will conclude my presentation. Hopefully you guys liked it.